All right, I'm going to talk about the MP Fellowship Program at Lamprey Healthcare and give some background about the program. I'm actually going to start first with some background about Lamprey. So Lamprey Healthcare is a federally qualified health center, which means that a significant part of our funding comes from the federal government so that we can provide wraparound services and see uninsured patients and see them on a sliding scale. So we're a very mission-driven organization. We see people regardless of their ability to pay. We work really hard to increase accessibility to primary health care and to mental health services. So that's sort of how we were founded and how we continue to operate. So the first office opened in 1973 in Newmarket. After that came Raymond in 1981. And then in 2000, we opened a Nashua office. So we have those 3 locations in southern New Hampshire. We've been around for a while. We're well known in the state. Again, trying to provide a lot of access to primary care services. So with a real focus on not being concerned about people's ability to pay. So that's really like the environment we're working in. Each of those 3 sites is a little bit different in terms of how it feels, different sort of patient populations. We do in the fellowship program, we'll get there, but try to like rotate people through all 3 sites to get the experience of all 3 places. But we do all work really well together. The providers get all together on calls, in meetings, and there's a lot of collegiality between the 3 sites. The nurse practitioner family program itself was started 9 years ago. We're in our 9th cohort of fellows, which is exciting. And we are the only family nurse practitioner primary care residency in New Hampshire. So we are it for the time being. And our mission is to build confident and competent family nurse practitioners who will contribute to workforce needs in the state of New Hampshire, and ideally in an integrated team-based primary care setting. We want to prepare people for that. Whether or not that's where people end up depends on what's a good fit for them and what job opportunities are available in the community. But we really want to prepare people to work in primary care, to work in community health, and to feel ready to do that so that they can be successful. So the first cohort was in the fall of 2017, and that was in Newmarket. We had 2 fellows there. And over time, we've sort of expanded. We moved to Raymond when I took over as a preceptor 4 years ago. And then last year, expanded back to Newmarket. So we now have 2 fellows in Raymond and 2 fellows in Newmarket. So now we have 4 in-house fellows. I say in-house because we also have a number of fellows at external sites who are employed by outside clinics. So they're not technically employees of Lamprey Healthcare, but they still attend parts of the fellowship program. And we consider them part of our program, which is great. We are accredited, which is exciting. We were accredited in July of 2024 by the Consortium for Advanced Practice Providers. This is starting to be a requirement for HRSA funding. Our program is largely funded by a HRSA grant called the Advanced Nursing Education Nurse Practitioner Residency Grant. And part of that grant was to become accredited, but obviously being an accredited program is probably something we would have pursued anyway, just because it holds us to standards of excellence, right? In terms of our didactic programming, our academic partners, and sort of the quality of precepting that we provide to our nurse practitioners. So with regards to that, in terms of quality of precepting, we have a preceptor in the Raymond office, which is myself. And then on Mondays, Ling Chen is another nurse practitioner. She actually covers on Mondays because Mondays are my admin days, as I'm also the clinical director. In Newmarket, Sarah Wood is the preceptor. She's an NP with years of experience. She's excellent. So it's a 1-to-2 ratio for preceptor to NP fellows. And Sarah and I and Ling both have really reduced patient schedules. So we're only scheduled at 1 patient an hour so that we're very available to the fellows we're working with. Our primary job is to precept and to mentor. Our sort of like second job is to see patients, both to, for multiple reasons we continue to see patients, mostly because we want to, and it increases accessibility and it's just, it's part of being a family nurse practitioner, obviously. So it's very closely mentored program. The other sort of gentle bit about it is it's a really slow ramp up. So the ramp up for in terms of patient numbers is much slower in the NP fellowship program than it is at typical clinics if you're starting as a new provider. The goal at the end is that you're scheduled at, I believe it's 2.1 patients an hour, but that's what you're scheduled at. So it's some days you'll actually see 2 patients an hour, but because of no-shows, it typically is not a 2 patient an hour schedule, but we're trying to get folks there so that they can transition into a primary care role where that's the expectation. But it's very slow. We also accommodate individual needs in the ramp up. So there's a set template, a set schedule, but if folks are struggling or they have something going on personally, we adapt it, right? So not everyone is always following the template exactly. It's very individually focused in order to support people with what they need to feel confident and successful in the work they're doing. So that part of the program is called, where you're seeing patients, we call that continuity clinic. And it's called that because you're providing continuous care to patients. So you sort of establish your own little panel. You'll see people typically off of my panel, but you'll also establish new patients, and those will become yours for the year that you're in the fellowship. So if you see them and you start them on an SSRI and they need a follow-up in 2 weeks, you will see them in 2 weeks for that follow-up. So this way you get to know patients, you get to provide care, longevity of care, and it's a really great opportunity to really feel what primary care practice feels like, because you will be doing that. You'll be providing primary care. So that's 25 clinical hours a week. So that's one chunk of the program. In Raymond, those hours are, the clinically scheduled hours are 8 to 4 on Monday, Tuesday, and Thursday, and 8 to noon on Wednesday. I always like to put a big asterisk on that because the schedule is 8 to 4, but typically fellows are in the office till 6, just in terms of completing notes and getting their work done. Some fellows choose to leave at 4:30 and then they do their notes later. That's fine. There's no rules besides getting your notes done within 3 days. But I always tell people, like, you're not actually going to be like walking out the door at 4 o'clock on most days. And we end at 4 o'clock clinically to give you sort of that extra admin time in the afternoon to catch up on documentation. On Wednesday afternoons, we have a didactic session. So we meet from like 1:30 to 3:30-ish to check in. We meet by Zoom, so the external site fellows come as well. We check in about cases that week, about personal things that week. There's a case presentation, and there's a didactic presentation, sometimes by myself, sometimes by an outside presenter, usually from one of our academic partners, but we also have some other folks in the community who we've forged connections with and relationships with, and they'll come and present on a topic. On the extra day, so that's the schedule in Raymond. In Newmarket, it's a little bit different. The continuity clinic is Monday, Tuesday, Wednesday morning, and Friday. And Thursday is their specialty clinic day. In Raymond, Friday is the specialty clinic day. So on Fridays, we place you with an outside specialist, and you shadow for the day. You get to ask them questions. We encourage you to have that rotation in the spirit of a primary care provider, and usually the specialists know that. So they tend to frame things as, this is what you should refer to me, this is what you can manage yourself, and it can be really helpful. Fellows usually come out of those rotations feeling like it was a really beneficial experience. We also sometimes just rotate you through in-house providers. So like you might go to Nashua for a day because the Nashua population of patients is much different than the Raymond population of patients. And just to get a feel for a different provider. You can learn lots of different things from lots of different styles. So it's a good opportunity just to see how someone else practices in our clinic than just your preceptor. So that's what happens on sort of the day that you're not in continuity clinic. Other parts of the fellowship program, there are some other sort of responsibilities outside of the continuity clinic and attending your specialist rotation day, which is there are case presentations. So we rotate those in didactic sessions and have, it's one case presentation per week. And so we usually have like 7 fellows, give or take. So it's an every 7-week rotation. It's not a huge time commitment, but we ask you to like write up a case and present it at the didactic. There are also monthly reflections. I send out a reflection prompt, and you're expected to write, a paragraph to a page reflecting on that. We do very frequent evaluations. So we have evaluations every it's 3 months, baseline, 3 months, 7 months, and 12 months. They're very thorough. You do a self-evaluation. I evaluate you, or your preceptor evaluates you. You evaluate your specialty sites. You're also, every week, you're expected to evaluate the didactic session. There's like a lot of evaluating. You evaluate me. The evaluation is 2 ways, right? It always goes both ways. Lots of evaluating, lots of checking in. There's also evaluating happening on a daily basis, right? Like your preceptor is always going to be giving you feedback, reviewing your documentation, talking about patient cases with you. This is a very sort of feedback intensive program because we're really focusing on growth and support, and that's the idea. The one other project is a quality improvement project. We usually don't even start talking about that till about halfway through the fellowship. Typically people work in groups on this, but basically we ask you to identify something that can be improved at your clinical site and to implement an intervention, to collect some data and present how it went with your intervention and what changes you were able to make, if any. So, and then you just like present that at the end of the fellowship with like a little PowerPoint in our didactic session. It's really pretty casual. It's also pretty neat what people do. We've actually like made some really positive impacts at our clinics. So it's cool to see people come up with those projects. All right, so then a little bit more in terms of benefits and pay and things like that. We currently post the salary at $80,000 a year, which is certainly, people will go like, oh, that's low. I'm going to be totally honest about that. It's low for a starting NP salary. I would emphasize that this is a 25 clinical hour position, right? So this is not like a 34 clinical hour position. And a lot of it is education. So it's sort of, and it's low patient numbers with a lot of support. So it sort of reflects that. It is, something that people want to know about. So I like to be honest about that. Obviously, I'm always trying to push to bump that up a little bit. And so I will continue to do that. But that is the salary. But there are other benefits. So there's CME money, which is currently $2,000 a year, but I hear they're going to bump that up as well. The CME money can be used for travel, for food during conferences, for conference fees, for resources, for online courses. It can be used. It's really pretty flexible money. There are great benefits in terms of health insurance. We have something called an ICRA model, which I'm not going to get too into, but basically you'll have little to no premium on your health insurance and you get a pretty decent plan. So I would say that is something I feel really good about at Lamprey right now. It didn't used to always be that way, but we now have this pretty great health insurance plan. Even if you are insuring your whole family, it's still a pretty great plan. And people can afford it and are happy with it at our clinic. We also reimburse for licensure. So your fees for your, FNP certification, your fees for your state licensure, your DEA license, those are all reimbursed. They don't come out of your CME money. It's like a separate bank, and so those get reimbursed. And we also pay for 1 professional membership a year. Usually I encourage people to become members of NHNPA, but you could also use it for AANP or any other group that you want to be a member of. We will reimburse you for that. And there's also the potential, because we're a federally qualified health center, there's the potential for loan repayment in the future. So there's both a state loan repayment program that, if you're working full-time, will reimburse up to $45,000 of loans over 3 years. And then we also qualify for HRSA loan repayment, which you can get, I think, $50,000 of reimbursement in 2 years of work. So you can't apply for that in the fellowship because the fellowship is a 12-month position and we can't guarantee employment afterwards. But if you do stay here, you could actually do your fellowship year and then start here as an employee and immediately apply to those programs, so that in 2 to 3 years your loans are significantly reduced. So, and the one other thing I would say is the compensation at Lamprey for nurse practitioners after the fellowship is great. So So it's a great place to work. Lamprey really values nurse practitioners. We practice autonomously and independently at Lamprey Healthcare. We have our own panel of patients. We manage our own desktops. We work collegially with physicians and PAs. It's a great team. Again, very mission driven, and it's a really